All right, so the next factor that might limit our neck, our ability to kind of relax our neck on the side, would be our SCM. Okay, so that's our kind of side, that's our muscle here. The SCM is an accessory muscle of respiration. You can kind of see mine activating there a little bit. And what the SCM does is it can pull the rib cage up if I need it to help with breathing, or it can rotate my head in the opposite direction. It's a contralateral rotator. Finally, it kind of also does that. It's a kind of a side flexor. So if you see your neck, right, and you're kind of like that, what that tells us a couple things. One, SCM's tight. Two, to some degree, you're rotating to the other side. Okay, so that would make it harder to come back in this direction. Okay, so there are two things that we want to do in order to relax the SCM. One, we want to put the chest wall in a position to expand, but two, there's kind of a lateral flexion component to that, which kind of gets all this to relax. And two, it's kind of like looking or rotating in this direction is going to relax it, okay? And so with that said, there's not necessarily a really good release for the SCM just because it's the neck. I don't necessarily want to mess with it in that way, but what we are going to do is we're going to work on just releasing the SCM in a bridge position. Okay, so think of the bridge as like standing, but we're just supported. So I've got my feet on the ground, I've got my weight on the inside of my feet. I'm bridging up just in the last video. What I'm also going to do is just sort of, I can kind of just extend my arm out or pull my shoulder blade back, see if I can get a little bit of a chest stretch on the right. We're going to assume that it's our right SCM because I see that a lot. And so thing one is we're just going to side bend to the right a little, or side bend to the left a little bit. Okay, and what you'll probably feel here is nothing, which is a good thing. Like, we don't want to feel a super stretch. All I want you to do is we're going to keep our bridge going on. We're going to side bend our neck just a little bit to the left. We're going to breathe in and exhale. And our goal is just to keep our bridge. Okay, and we're just going to do about 5 breaths in this position. You could probably feel like the angle between your what is this? Your shoulder and your ear kind of opening up a little bit. What you can also do is a bit more of a downward reach. Like right now I'm kind of reaching to the side, but you can also go a little bit more downward to kind of assist in that process. And then from there, all we're going to do now is we're going to keep the same idea, the same downward reach, but I'm going to rotate my head to the right. So, and I mean a little bit to the right. I'm not going all the way because my neck's going to want to come off with this bolster. So I'm just going to do to the degree where I can stay on the bolster comfortably, kind of put my eyes to the right as well. Continue to reach away or kind of unshrug my shoulder. And that alone should really help should really help the SCM to let go. And then from there, we can just sort of redo that in a seated position. So in the seated position, I'm going to do a tricep extension on the right side. I'm going to kind of side bend my neck a little bit, look to the right. And then follow up by just sort of rotating my head a little bit to the right, just making sure that I keep my head in line with my body. And that should help. And you can retest it by just seeing how far you can rotate your neck, as well as how far you could side bend your neck. If that got better, you should actually be able to side bend your head further to the other side. So like for me, I would see my left side bend improve because I relaxed this to some degree so this can let go. Okay, so anyway, those are some thoughts on the SCM. Give that stuff a try if you're finding you're having like neck stuff and some of the things to rotate you back in that direction are not working like we want them to.